All right. So in this audio lecture, you're going to be learning about congenital defects. And so these congenital defects are going to be abnormalities in these ventricular and atrial walls. Okay. So what is it? This is a structural issue. And so this is going to be an incomplete closure of a septum or a bypass that is still present after birth. Okay. This is the most common type of birth defects. We have multiple examples of these birth defects. Some conditions like Down syndrome really they don't encourage, but you find these in higher incidence in individuals with some congenital disorders like Down syndrome. So we have septal defects, and septal defects can occur in the walls separating the chambers, and so we could have ventricular septal defects or atrial septal defects. And so if we remove these outflow tracts here, you would see that there's a septal wall connecting the right atria to the left atria. And during fetal life, we have a hole there. It's called the foramen ovale. And so the foramen ovale allows blood to move from the right atria into the left atria during a time when the lungs are non-functional. So when the lungs are non-functional, we don't need to send blood there, or a lot of blood. And so we have a septum, a foramen, a little connection between these two chambers. This allows blood to move from the right atria into the left atria. Okay. We have another structure that is similar that this doesn't show, but this is the ductus arteriosus. It would be right here. And so the ductus arteriosus allows blood to move from the right ventricle into the aorta because, again, it's already been oxygenated by the maternal placenta. Right? So you have the structure that is responsible for oxygenating blood at a time when the fetus is not actually breathing. Right? So it's not breathing air, so it doesn't make sense to start exchanging gases there. We don't breathe liquid. We might aspirate some fluid, and that's why they need to suck out a newborn's lungs when they're first born, but we're not getting any oxygen from that fluid. Okay. We have valve disorders. If you have these valves could be impacted, right? So maybe in our semilunar valve right here, in the aortic semilunar valve, we only have 2 valves instead of 3, right? So remember, the semilunar valves are 3. We might have 2 valves, or we might have them slightly fused, or we might have a defective chordae tendineae that affects these valves. Okay? And so anything that's going to impact cardiac output and stroke volume would be an example of these congenital defects that decrease cardiac output. We could get dextrotransposition of great arteries. And the dextrotransposition of arteries is a term that is referring to outflow tracts being connected to the wrong ventricle. Right? And this is of great concern, because if you have your right ventricle supplying blood to the systemic circulation, then you're not going to have the power necessary to be able to move this, and you're not going to be able to exchange as much blood, right? So this is a pretty prominent condition, and you would have to get it taken care of right away. And the dextrotransposition of the great arteries, and then tetralogy of the phallet. Right? Tetralogy of the phallet is a condition in which you have a ventricular septal defect. So this is an example over here. This is an image of it. And you have this incomplete closure of the interventricular septum. As you can imagine, then you get mixing of blood from the left and the right ventricles, which decreases the overall oxygenation patterns. Okay. In this condition, you get narrowing of the pulmonary semilunar valve. And so right there, you are increasing resistance of your pulmonary circulation, and so the blood is then going to be moved to the area where resistance is less, which would be your aortic semilunar valve at that point. To try to compensate for this stenosis here, your right ventricle is going to hypertrophy because you're encouraging more work, and we see that this right ventricular hypertrophy is right here again, and it's because we have to generate more pressure by our right ventricle to move blood into our pulmonary trunk. And we also have a misplaced aorta. Now, what does this mean? This means that the aorta is closer down towards this ventricular septal defect, and so now when the right ventricle contracts, we get deoxygenated blood moving up into the aorta. Okay. And so this condition can vary pretty considerably. And so the defect really has various ways it can manifest. And so what are the manifestations? These manifestations, depending on the congenital disorder that is present, we could get them highly variable. And so we can actually see the manifestations be asymptomatic, okay, meaning they're not really present. But when we do see symptoms, they generally are pertaining around this idea of decreased cardiac output and what you would see in a decreased cardiac condition, right? So where we have decreased oxygenation of blood, we're pumping less of that blood out to the tissues. Um, so we have all the general manifestations of decreased cardiac output: tachypnea, tachycardia, fatigue, tissue ischemia, right? So all these general manifestations of decreased cardiac output, okay. We have heart murmurs, so in the case of the septal defects, we get blood moving in directions that it doesn't normally move in, creating a swooshing sound, some additional sounds in addition to the lub-dub, S1 and S2, of the AV valves, the semilunar valves closing. Okay. Tachypnea, so here we see a different breathing response, and this is fast breathing. And so if we get fast breathing, this is in an effort to increase oxygenation of our blood. Okay. But it's slightly inefficient, and we're not able to load as much oxygen on those red blood cells as necessary, and so our blood appears kind of blue in appearance. Now, this could give you chest pain or chest discomfort, and so this could be due to angina, right? So if you're not oxygenating your blood enough, the myocardium is not receiving enough oxygen either, and that can result in chest pain, a topic that we touched on in aneurysms. All right, and so for treatment of, all right, so here we have various diagnosis techniques, and so we're going to do a medical history, a physical examination. We'll do standard cardiovascular tests. Okay, included in these can be echocardiogram right here, electrocardiogram, okay, and X-ray. Right. This would allow you. So X-ray is not really going to tell you much about septal defects. An echocardiogram may tell that, in an ECG. But really, the fetal ultrasound is really going to be what tells you about what is exactly going on. So here's an X-ray showing something on the outside of the heart that is affected, and this is going to be a coronary artery. So treating these disorders, they'll do catheterization. So they'll insert a catheter up into your heart, and then they'll try to repair the holes in the heart, the septal defects. Okay, that would be included under the surgery. They're going to reduce cardiac work, so demands on the heart. So individuals who have patent holes when they're born, okay, from incomplete closure of the atrial septum or the ventricular septum. We see that we want to reduce the amount of cardiac work, and so we would use diuretics. And again, diuretics are going to decrease your blood volume. Okay. And if you decrease blood volume, you decrease the amount of work that your heart has to do, the afterload, reduce the afterload. Over here we have antihypertensives, so medications that decrease hypertension. And so by that you are decreasing the afterload, and anti-dysrhythmics. Right. And so treating kind of any dysrhythmia that can occur. But the last case scenario is a heart transplant. Usually the surgeries, when taken on early in life, are pretty effective. And so we see individuals with Down syndrome oftentimes get surgery in their first year of life. And they're pretty successful. So before they get the surgery, they're tired, and they're kind of blue in appearance. They're not typically too active. And then after the procedure, activity starts to increase, and these individuals start to do much better. All right, so that is it for the congenital defects. Until next time.